So before you reach for the statin, check your nutrition. The right nutrients can lower inflammation, improve circulation, and even reduce cholesterol naturally. So here are the three top nutrients that I use in my clinic, and I personally use them as well. And I'm going to give you two bonus ones that I think are also very, very beneficial in the world of cardiovascular health. So the first one that I use in my office is an omega-3 fish oil. This is the body's natural inflammatory. What we see with omegas is the people who consume more fish oil historically have the best heart health in any DNA that we look at. But the thing with omegas are you want the best outcomes for what you're going to consume. So you want an omega with EPA, that's an all-around high-quality omega that you'll find in it. DHA is an omega associated with higher levels of brain health and brain function. And in a third one, GLA. GLA is its research, it's backed with reproductive health, both men and women. So you want an omega with EPA, DHA, and GLA. Okay, so that's the omega. The second thing that you want is vitamin D3 with K2. Now, vitamin D3 with K2 is phenomenal, but the thing about vitamin D3 with K2 is you don't want to go too high with it. You got to be careful with it because you can go really high. So if you are taking high dosages, make sure you're following them with labs like I do in my office because everybody has a different dosage. A great place to start as an adult, providing you don't have any XYZ conditions that would cause a problem, it'd be about 4,000 international units a day. Okay, so K2 does is it protects the arteries from calcium buildup. It's also a pretty powerful anti-inflammatory. The third one that I like, this niacin, this is also known as B3, but be careful with niacin because if you take too much of it, you can have this flushing sensation where your skin, it feels like it's crawling for a while and it heats up. It'll last a few minutes. If anybody's experienced that, it's not desirable. But niacin is well known to improve levels of healthy cholesterol and even improve blood flow. But you need to dose high enough to get the benefits of it. And a lot of times when you get the benefits of it, you start getting that flushing. So you want to get a niacin that is reported to have less flushing or a slower release, which you can find. Okay, so the two bonus ones. One of the other ones, the additional ones that I love in my office is CoQ10. CoQ10 is the antioxidant for the heart. It's the healing antioxidant. And when people are taking cholesterol-lowering medications like statins deplete CoQ10. So it's imperative you take CoQ10 when you're taking a statin. So that's what CoQ10 is, and you want a relatively healthy dose of CoQ10. The other one is really a group, and I think this one, now I'm thinking about it, might be my favorite. These are nutrients that increase blood flow everywhere in the body, in the brain, in the heart, all arteries. It increases blood flow by dilating your arteries. One is vinpocetine. Another one is N-acetyl-L-carnitine. And then the third one that I really like is L-citrulline. And some high-quality supplements have all three packed together. And what that does is it promotes blood flow everywhere in the body. It can reduce blood pressure. It can improve brain function. I've even prescribed it for some of my patients dealing with erectile dysfunction because it even can improve that. So these are nutrients that improve blood flow everywhere in the body. And if it's doing that, it's improving heart health. So when you use these nutrients correctly, blood pressure can actually normalize. Arteries tend to stay flexible, and you can literally lower your risk of heart disease without any nasty side effects. So these nutrients tend to support your heart's energy factories and keep your vessels smooth instead of stiff. So if you're looking for the entire picture of heart health, my colleague and I created a course, a heart health course, where we get into all of this. I get into different supplements beyond what we talked about here so far for different purposes, whether it's hypertension, high blood pressure, high cholesterol, plaquing, etc. I get into supplementation and nutrition, dietary efforts, other lifestyle pieces, labs that I'd recommend ordering, questions to ask your doctor, and the best part of it, it's in a step-by-step strategy. And the other best part of it, at the time of this recording, is perfectly free. It's completely free. So the link will be in the description. Take advantage of it while it's still up, while it's still available. And I look forward to talking to you in the next one.